On behalf of the entire University of Maryland medical system, I want to take a moment to personally thank each and every one of you for what I am seeing as the tireless effort that we are collectively putting forward on behalf of the communities that we serve, the state of Maryland, and indeed the nation. I have been part of this health system for nearly 30 years, and I am truly inspired by what I am seeing in terms of our collective response to this current healthcare challenge. It has undoubtedly been described as a challenge that is a once in multiple generations type of challenge. And the types of teamwork and innovation that I have witnessed over the last few months is what defines my fervent belief that we as a health system are a state and national resource. I want you to be reassured that collectively, all 28,000 of us, we are in this fight together. But those of us who are in healthcare, we know that ours is a noble cause, that we stand ready to answer the bell when our communities need us most. And I am seeing this demonstrated across our entire organization. I am seeing countless examples of selfless effort where we are caring for our patients and our communities, and at the same time, we are able to care for each other. And for that, I am so profoundly grateful. I want you to also be comforted that at this time of great challenge, we are leaning on partnerships that have historically defined us. We are leaning on our partnerships with the state of Maryland, with the University System of Maryland, with our partners at the School of Medicine. And as we take on this unprecedented challenge, we are also partnering with the other academic health system that exists here in the state of Maryland. Of the challenges that we face, I will tell you that my own personal challenge is actually practicing the efforts of social distancing that we know are so critically important in helping define how we can limit the spread of this disease. I'm commonly now comfortable quoting myself in the historically typical advice that I give my teenage daughters. When I historically would have said, put down the phone and start talking to each other in person, now I'm following their lead. And I'm using technology to my advantage to, in fact, achieve the social distancing that is so important in this fight against this virus. So again, on behalf of the entire health system leadership team, I want each and every one of you to know how profoundly grateful we are. I thank you, and I look forward to being able to continue to communicate with you active updates of where we stand in this fight.